Pseudoexfoliation Syndrome, PXF, is a condition in ophthalmology with distinctive features and complications. This video will cover PXF's causes, symptoms, diagnostic challenges, ocular effects, management, genetics, research, and prognosis. Gain comprehensive knowledge to effectively diagnose and treat PXF. Pseudoexfoliation syndrome, or PXF, is a disease where abnormal material, called pseudoexfoliative material, PXM, builds up in eye tissues. It affects the front part of the eye and can lead to glaucoma. The cause is not fully understood, but age and genetic factors are believed to be involved. PXF is more common in Caucasians and increases with age. In summary, pseudoexfoliation syndrome is characterized by the accumulation of abnormal cellular components in the eye. Genetic factors and environmental factors both play a role in its development. In this section, we will discuss the clinical presentation and diagnostic challenges of pseudoexfoliation syndrome, PXF. PXF may initially be asymptomatic, but as the disease progresses, patients may experience blurry vision, glare, and varying eye pressure. Examination can reveal distinct characteristics such as granular deposits on the lens capsule, weak or dislocated lens, pigment dispersion, and increased pigmentation in the trabecular meshwork. However, it can be difficult to differentiate PXF from other conditions like open-angle glaucoma, pigmentary glaucoma, or cataracts due to similar features. Pseudoexfoliation syndrome, PXF, affects various parts of the eye, causing complications such as cataracts, lens displacement, glaucoma, and optic nerve damage. Prompt management is crucial to prevent irreversible vision loss. Pseudoexfoliation syndrome, PXF, is associated with pseudoexfoliative glaucoma, PXG. This form of glaucoma is caused by impaired fluid drainage due to the accumulation of PXM. Treatment focuses on reducing eye pressure through medication, laser treatment, or surgery. Medications that reduce fluid production are commonly used. Cataract surgery and pseudoexfoliation syndrome, PXF, requires special considerations due to weak zonules. Techniques like capsular tension rings, hooks, and glued intraocular lenses can be used. For PXF patients with glaucoma, combined procedures may be necessary to manage both conditions. PXF is now recognized as a systemic disorder with associations and comorbidities beyond the eye. Several conditions have been linked to PXF, including cardiovascular diseases, cerebrovascular diseases, hearing impairment, and Alzheimer's disease. The underlying mechanisms behind these associations remain unclear, but it is suggested that common genetic and environmental factors may play a role. The presence of PXF should alert clinicians to screen patients for these systemic conditions and manage them accordingly. Significant advancements have been made in understanding the genetic basis of PXF. Multiple genes have been implicated in its pathogenesis, with the strongest association observed with LOXL1 gene polymorphisms. LOXL1 gene variants, particularly RS1048661 and RS3825942, have been identified as major risk factors for PXF development. These polymorphisms are important for risk stratification, early detection, and genetic counseling of PXF patients and their families. Additionally, further research is underway to explore other genetic factors contributing to PXF susceptibility. Medical therapies for PXF primarily aim to lower IOP and preserve optic nerve function. Topical medications, including prostaglandin analogs, beta blockers, alpha agonists, and carbonic anhydrase inhibitors, are commonly prescribed to control IOP and reduce the risk of glaucoma progression. Additionally, recent studies have investigated the role of antioxidant agents, such as vitamin C, E, and selenium, in PXF management. These agents target oxidative stress, which is thought to contribute to PXM accumulation and disease progression. However, further research is needed to establish their effectiveness and optimal dosing regimens. As our understanding of the pathophysiological mechanisms underlying PXF continues to evolve, novel therapeutic approaches are being explored. Targeting specific pathophysiological pathways, such as the enzymes involved in PXM production, may offer potential therapeutic benefits. Enzyme inhibitors, including LOXL1 inhibitors, hold promise in preventing PXM deposition and subsequent ocular complications. However, these approaches are still in the experimental stage, and further research is needed to determine their safety and efficacy before translating them into clinical practice. Several prognostic factors influence the long-term visual outcomes in PXF patients. Higher baseline IOP, advanced age, severity of glaucoma, and presence of comorbidities are associated with a poorer visual prognosis. Early diagnosis, prompt initiation of treatment, and regular monitoring are crucial in optimizing visual outcomes. Long-term follow-up is essential to evaluate the effectiveness of treatment strategies and make adjustments as needed. Ongoing research in pseudoexfoliation syndrome, PXF, is focused on understanding its causes, developing new treatments, and improving patient care. Genetic studies are ongoing to identify more genes associated with PXF. Imaging techniques like OCT and ultrasound biomicroscopy provide better ways to diagnose and track PXF. In the future, personalized medicine based on genetic profiles may improve the management of PXF. In conclusion, pseudoexfoliation syndrome, PXF, is a complex disorder with various eye-related effects and systemic comorbidities. Proficiency in recognizing its origins, symptoms, diagnosis intricacies, eye complications, and treatment approaches is crucial for effective management. Ongoing research and advancements are expected to improve diagnostic techniques, treatments, and personalized care, ultimately leading to improved visual outcomes for PXF patients.